So, today we shall be discussing a new topic in community medicine, which is disaster management. So, disasters are defined as any occurrence that causes damage, ecological disruption, loss of human life, or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. The key here is the response from outside the community, from outside the area. So whenever that happens, the damage or disruption is labeled as a disaster. So these can be natural disasters or they can be man-made disasters. A hazard is defined as any phenomenon that has the potential to cause this disruption or damage, which we have talked earlier. So there are many types of disasters and they can be classified in many ways as well. One such classification is in front of you on your screens. The disasters can be meteorological disasters and examples are storms, hurricanes, cyclones, cold spells, heat waves, drought, smoke, or tornadoes. Then there are topological disasters, which include floods, avalanches, landslides, or tsunamis. Then there are telluric or tectonic disasters, and these include earthquakes and volcanic eruptions. Then there are accidents, which are so huge that they warrant an outside the community response, and examples of fires, massive fires, collisions, shipwrecks, train crashes, failure of dams, tunnels, or buildings, and mine explosions. And finally, there are man-made disasters which include atomic explosions, terrorism, wars, and there are two specific examples which we shall be quoting later on as well, and those are Chernobyl disaster and the Bhopal gas tragedy. Mortality due to a disaster depends upon several things, and it increases with the type of disaster, kind of disaster that has occurred, that will determine the mortality due to it. Also, the density and distribution of population. The more dense the population, the more will be mortality. Condition of environment is something that also determines mortality due to disaster. Degree of preparedness, a higher degree of preparedness will result in lesser number of dead. Similarly, opportunity for warning. If there was an opportunity for warning prior to disaster, that will result in a lower mortality. Morbidity due to a disaster can be of several varieties, and it may be physical injuries, it may be emotional stress, it may be epidemic of disease, an outbreak of disease that occurs after a disaster has struck, or it can be increase in indigenous disease, a disease that was already present there or endemic there that can increase its incidence after the disaster. Next, we move on to the management of a disaster, how it should be managed. So there is a disaster cycle or disaster management cycle to be precise, and things move according to this cycle. Uh, every time a disaster has an impact or a disaster strikes, the immediate time period after it includes the recovery phase after disaster, and it includes a response, rehabilitation, and reconstruction. So after a disaster has struck, there will be recovery phase after the disaster, and it is further divided into the immediate response after the disaster impact, then rehabilitation and reconstruction. The other phase after this is a risk reduction phase, which occurs usually before a disaster. And risk reduction phase includes mitigation and preparedness. So this is the disaster cycle or disaster management cycle. So the recovery phase after the disaster has struck includes response, rehabilitation, and reconstruction. The response phase, which is immediately after a disaster has had an impact, it includes search and rescue, first aid, field care, triage, tagging, identification of dead, relief phase, epidemiological surveillance and disease control, vaccination, and nutrition. Triage means prioritizing the victims according to their injuries and identifying the ones who need immediate medical help, and also the ones who will respond to immediate medical help and their lives can be saved. So in triage, we categorize the victims into four categories and then label them with different colors. The red will be the high priority patients for transfer, which have had an injury, but they can be saved, their lives can be saved. Yellow are medium priority, these are after the red. They can be managed, but they can be delayed a bit as well. Green are the ones who are ambulatory patients, and they can wait, and they are dealt with after the medical services have dealt with the red and yellow labeled victims. Black are the ones who are dead or moribund patients, and the outcome in them is not very, uh, the outcome in them is bleak, and they're not likely to survive, or the dead people, so they are of least priority in providing medical care. The relief phase starts when assistance from outside starts to reach the disaster area. Damage assessment is carried out to identify needs and resources, and there are four components of managing humanitarian supplies. These are acquisition of supplies, then transportation of those supplies, storage of these supplies, and eventually the distribution of these supplies. Infectious disease outbreaks may occur after a disaster. Not only the outbreaks of a new disease, but also the endemic disease in that area, a disease that was already present. The incidence of that disease may also increase, and this is usually due to overcrowding and poor sanitation after the disaster. When people are the victims, the survivors are kept in camps or temporary shelters. Population displacement is another factor which is responsible for increase in communicable disease transmission after a disaster. Disruption and contamination of water supply is a factor. Disruption of routine control programs. If EPI was going on in that area routinely, but after the disaster it has been disrupted, this will increase in many of the infectious diseases that are routinely covered by vaccine in the EPI. uh, those diseases will increase their incidence. Then there are ecological changes, for example, increase in vector population, more mosquitoes and flies and other vectors. Displacement of domestic and wild animals, this may result in zoonosis, and the diseases that can be transferred from animals to humans, they may increase. Emergency food, water, and shelter can become a vehicle for transmission of infectious diseases. The most common communicable disease after a disaster is gastroenteritis. That is seen most commonly, and it occurs immediately after the disaster has happened. So obviously, control and prevention of such communicable diseases will be required after a disaster. The principles of prevention and control of communicable diseases after a disaster are: first of all, implement all public health measures as soon as possible. Whatever the public health measures that were there in place before the disaster has struck, those ones, as well as the public health measures that are required after the disaster has impacted a community. those as well. These public health measures have to be implemented immediately after disaster. Organize a reliable disease reporting system. So, disease surveillance system will have to be updated and organized, and it should be made reliable so that whatever is happening in the community post disaster should be in the knowledge of the authorities who are responsible for implementing the public health measures. And finally, investigate all reports of disease outbreak. You will study the investigation of an epidemic, and or you have already studied the topic of investigation of an epidemic. Those principles of investigation of an outbreak are applied, and every outbreak is investigated. Vaccination after a disaster has struck is recommended only for healthcare workers that are working in that area where the disaster has happened. And typhoid and cholera vaccinations are not recommended. The reasons for not recommending these vaccines are poor compliance, manpower shortage. These may give a false sense of security. Improper injection techniques may be used since a large number of people have to be vaccinated and manpower is short, and non-availability of cold chain facilities. So these are the reasons why some of the vaccines, or in fact all of the vaccines, are not recommended post disaster. Tetanus vaccination is at the discretion of a physician only. The person who is attending to the victims of a disaster, he or she may decide if the victim or the survivor needs tetanus vaccination or not. So, after a disaster has struck, there may be damage to crops, stocks of wheat or other edibles, and also there may be damage to distribution system of edibles. Infants, children, pregnant women, nursing mothers, and elderly are more prone to malnutrition after disaster. Emergency steps for ensuring food relief are number one, assessing food supplies after disaster. You have to make an assessment about the supplies that are available. Assessing the nutritional needs of affected populations, you have to calculate the demand. Then calculation of daily food rations, how much of daily supplies will be required for the population that is there. And finally, monitoring the nutritional status of affected population. Is it going down or is it remaining stable? That monitoring is also required. Rehabilitation involves the restoration of pre-disaster conditions. First of all, it starts immediately after the disaster, along with the response phase. These two phases start simultaneously from the very first day. Reorganization and restructuring of services may be required. Water supply rehabilitation will involve survey of all water supplies, distribution systems and sources, chlorination for elimination of most of the microbes, and cleaning, repair and disinfection of distribution and reservoirs, protection measures for existing and new water sources. And these protection measures will include the restriction of the access to people and animals by fencing, excreta disposal at a distance from water source, prohibition of upstream bathing, washing, and animal husbandry, and estimation of maximum yield of wells, and rationing may be done if necessary. Food safety rehabilitation involves kitchen sanitation and personal hygiene of cooks. These are important factors in this regard. So basic sanitation and personal hygiene are important components of rehabilitation, and it may include washing, bathing, and cleaning facilities for displaced people. Emergency latrines may have to be established. Vector control is required in the rehabilitation phase for prevention of dengue, malaria, leptospirosis, typhus, right, rat bite fever, etc. Social rehabilitation may also be required. Disaster mitigation involves measures designed to prevent hazards from causing emergencies or to lessen the likely effect of emergencies. Uh, it also involves reducing the vulnerability of the system. Examples of disaster mitigation are flood mitigation works, building of banks around the canals and rivers, improved building codes to mitigate the effects of earthquakes, improved structural quality of buildings, etc. Disaster preparedness involves a program of long-term activities where goals are to strengthen the overall capacity and capability of a country to manage efficiently any type of emergency. Aim of preparedness is to bring about an orderly transition from relief through recovery and back to sustained development. Appropriate systems, procedures, and resources have to be put in place. Preparedness is both at individual as well as community or state level. Uh, the disaster preparedness is an ongoing multi-sectoral activity. So, how do you go about disaster preparedness? First of all, evaluate the risk of the country or a region for a disaster, then adopt standards and regulations. Third thing will be to organize communication, information, and warning infrastructure, ensure coordination and response mechanisms, adopt measures to ensure that financial and other resources are available and can be mobilized in case of disaster. Develop public education programs, coordinate information sessions with media, organize disaster simulation exercises, test response mechanisms. So these are the steps for disaster preparedness. So Pakistan has a disaster management authority called National Disaster Management Authority or NDMA. It is a federal entity. Policy development for disaster preparedness includes establishing long-term goals, assigning responsibilities for achieving those long-term goals, then establishing recommended work practices, and finally determining the criteria for decision making. So these are the priority areas that have been identified within the National Disaster Risk Management Framework. Thank you very much. Have a nice day.